Hello and welcome to sqadia.com. I'm Dr. Mahnoor Ehsan with another video on the diuretic series. We all know that carbonic anhydrase enzyme catalyzes the conversion of bicarbonate and protons into carbonic acid. But do you know that sometimes we need to inhibit this enzyme throughout the body to achieve certain therapeutic effects? We will talk about this today. So let's get started. Carbonic anhydrase inhibitors include certain drugs which are Acetazolamide, Brinzolamide, Dorzolamide, Ethoxzolamide and Zonisamide. And among them, Acetazolamide, also known as Diamox, it is the prototype. And these all are basically sulfonamide derivatives structurally. Now comes the pharmacokinetic profile, and first we will see what is the route. So it is important that carbonic anhydrase inhibitors are available in a variety of routes to be used. They are available in the oral route as well as parenteral and topical. They can be used as tablets or extended release capsules. They can be given IV, and they are also available to be used topically as ophthalmic solutions. So you can see that they are available to be used by different routes. Next comes their site of action. So as you will be seeing that they are under diuretic category, so you might be thinking that they will act only in the kidneys. No, they will not only act in the kidneys, but they will also affect the eyes as well as brain. So let us see. In the kidneys, they will act in the proximal convoluted tubules. Then they will act in the eyes in the ciliary body, which is the site which is involved in aqueous humor production. And in the brain, they will affect the choroid plexus, which is involved in the CSF production. Next comes the duration of action. So as we have seen that they are available to be used by different routes, so duration of action will depend upon the route by which they are used. For example, if they are given IV, they will have a rapid onset of action but a shorter duration. So same will be with other routes. So duration of action will vary depending upon the route by which they are used. Next comes their excretion, and they are excreted by the kidneys and they are excreted in the urine. So these were the pharmacokinetic properties regarding route, site, duration of action and excretion. And what is different in these is that they are available by different routes and they are acting on more than one site. Regarding other diuretics, we were seeing that they were acting in the kidneys only, but they are here acting in eyes as well as in the brain. Next comes the dosage. So dose will again depend upon the purpose for which they are being used. For acetazolamide, dose will be different when it is used for glaucoma. It will be different for altitude sickness and different for epilepsy. So let us see what are the dosages which are available for these drugs. For acetazolamide, when we'll use it for glaucoma, it can be used as tablet or it can be given IV. So if we are using it as tablet form, then the dose will range from 250 mg once daily to 4 times a day. And if we are going to give it IV, then it will be 500 mg OD. Next, for management of altitude sickness, the dose will be 500 mg once daily. And for epilepsy, it will be 10 mg per kg. So you see that different doses will be used for different purposes. Next comes dichlorphenamide, and this is again used for glaucoma management, and its dose will range from 25 to 50 mg once daily to 3 times a day. Next comes methazolamide, and its dose ranges from 50 to 100 mg BD or TDS. And if we are going to use it for mountain sickness prophylaxis, then it will be given from 150 to 200 mg twice or thrice daily, depending upon the condition of the patient. And lastly, Dorzolamide. You should know that Dorzolamide and Brinzolamide, these both are available as topical solutions. Dorzolamide is available as a 2% solution and Brinzolamide is available as 1% solution. So if they are used topically for the management of glaucoma as a sole drug, then you will give 1 drop in both eyes 3 times a day. But if you are using them in some combination form where they are in combination with some beta blockers or other anti-glaucoma drugs, then the frequency of administration will be reduced. For example, if you are using some combination of dorzolamide and timolol, then you will give 1 drop twice daily. So this was the dosage, and we have seen that different dosages are available depending upon the effect that we are trying to achieve from the certain drugs.